the gradual loss of hearing in both ears. It's a common problem linked to aging. 1 in 3 adults over age 65 has hearing loss. Because of the gradual change in hearing, some people are not aware of the change at first. Most often, it affects the ability to hear high-pitched noises such as a phone ringing or beeping of a microwave. The ability to hear low-pitched noises is usually not affected. What causes age-related hearing loss? There may be many causes for age-related hearing loss. It most often occurs because of changes in the following locations. Within the inner ear, most common. Within the middle ear. Along the nerve pathways to the brain. Other things that affect age-related hearing loss. Continuous exposure to loud noise, such as music or work-related noise. Loss of hair cells, sensory receptors in the inner ear. Inherited factors. Aging. Various health conditions, such as heart disease or diabetes. Side effects of some medications, such as aspirin and certain antibiotics. What are the symptoms of age-related hearing loss? The following are the most common symptoms of age-related hearing loss. Speech of others sounds mumbled or slurred. Conversations are difficult to understand, particularly when there is background noise. Men's voices are easier to hear than women's. Some sounds seem overly loud and annoying. Tinnitus, ringing in the ears, may occur in one or both ears. The symptoms of age-related hearing loss may look like other conditions or medical problems. Always consult your healthcare provider for a diagnosis. How is age-related hearing loss diagnosed? Your healthcare provider will use an otoscope, which is a lighted scope, to check in the outer ear canal and to look at the eardrum. He or she will look for damage to the eardrum, blockage of the ear canal from foreign objects or impacted earwax, inflammation, or infection. You may be referred to a hearing specialist, audiologist, to have an audiogram. An audiogram is a test in which sounds are played through headphones, to one ear at a time. You are asked to respond if you are able to hear each sound. If a person can't hear certain tones, this suggests there has been some degree of hearing loss. How is age-related hearing loss treated? Your healthcare provider will figure out the best treatment based on how old you are, your overall health and medical history, how sick you are, how well you can handle specific medications, procedures, or therapies, how long the condition is expected to last, your opinion or preference. Treatment options for age-related hearing loss may include the following. Hearing aids. Assistive devices, such as telephone amplifiers or technology that converts speech to text. Training in speech reading, to use visual cues to determine what is being said. Techniques for preventing excess wax in the outer ear. What are the complications of age-related hearing loss? If your hearing loss is significant enough, you may need some type of hearing aid or other aids to communicate with others. What can I do to prevent age-related hearing loss? The most important way to prevent age-related hearing loss is to protect your hearing. Avoid loud noises and reduce noise exposure. Wear earplugs or special fluid-filled earmuffs, to prevent further damage to hearing. Key points. Age-related hearing loss is a gradual hearing loss in both ears. It is a common problem associated with aging. If you have sudden hearing loss, see your healthcare provider right away, as this may be the development of a serious hearing problem. Avoiding constant or continuous exposure to loud noises can help protect your hearing and prevent gradual hearing loss. It is not a reversible condition, so prevention is important.